Good morning. Hi, I'm Cheryl Sopcich, the Lead Educator of Health here at Bendigo TAFE.
And I'm Teresa Lamont, Administration and Project Worker.
This morning we're going to be offering you the information session for the Certificate 4 in Allied Health Assistance. I'm now going to share our screen and start the actual PowerPoint presentation for you to follow along. This won't take a moment. As I said, it won't take a moment. Here we go. This is our Health and Community Centre of Excellence on the corner of Macrae Street and Chapel Street here in Bendigo. Firstly, I'd like to acknowledge that our campuses are located on the ancestral lands of the Jara people of the Dja Dja Wurrung and the Walathiga people of the Yorta Yorta Nation. The Institute respects traditional custodians, elders and their cultural heritage. As I said, I'm Cheryl and I've got Teresa here with me today. Our primary coordinator and teacher for this unit is Helen Mossiter. This is our agenda, but I'll take you through the slides. Bendigo TAFE provides technical and further education to over 40,000 students across the state and at 10 campuses. We're a major training provider for the automotive, trades and health community industries, and we're talking about one of our health courses today. The why study at Bendigo TAFE. Our classes are smaller. We have up-to-date industry connections to give you, your career, a competitive edge. You undertake not just hands-on classes, but you get to study from text, online, and all of this makes you job ready with skills that you can kickstart your career. We have pathways into the universities, La Trobe, Deakin and Victoria universities. That gives you a head start into furthering your career at a bachelor level. There is a range of health and community studies available through Bendigo TAFE. This is just a list of them here. We're going to be talking about the Allied Health Services Assistance today. This Certificate 4 course is part of a nationally recognised qualification. It's competency-based, developed in partnership with industry, and it's portable, which means you can get a job anywhere across Australia. So what are the skills of health workers? You have the ability to work with vulnerable people. You need to have good communication skills and be part of a team, be caring, supportive, be empathetic and understanding. You, as a worker, needs to have emotional and physical resilience, and you're able to utilise a range of technical and procedural knowledge for your work. Now a bit of a course overview. There's 16 units of competency or subjects in this qualification. We have 7 core or mandatory units, and then we have some speciality areas which I'll talk about soon. These are your core units, everything from communication, diversity, recognising healthy body systems, following safe work practices, to name a few. Then we have some elective areas around assisting with movement, assist with an allied health program, conducting groups, and then we move into our specialisations. There's 2 units for each of our 3 specialisations, 2 for physiotherapy, 2 units under occupational therapy and 2 units under community rehabilitation. All this means that when you finish your course here at Bendigo TAFE, your Certificate 4 in Allied Health Assistance will have 3 specialisations: physiotherapy, occupational therapy and community rehabilitation. This makes you much more employable in the healthcare areas. Along with your training, you also gain what we call employability skills. This allows you to demonstrate initiative, communication, teamwork, be able to use technology and equipment, be able to problem solve and self-manage, to plan, and as a learner, you're open to guidance through the rest of your career. There are 3 ways to gain recognition if you already have existing qualification or skills and knowledge. One is through what we call direct transfer of identical units from another qualification, a credit transfer. You need to provide these credit transfers at the start of your enrolment. You can be assessed of your current skills and knowledge at what we call an RPL, or Recognition of Prior Learning interview, and you can fast-track assessment by completing assessment tasks up front. We'll help you determine your suitability for this RPL process, so please just let us know if you think that you would like to go down this track. There is still cost involved with an RPL process, and all of this has to be done prior to your enrolment. There is a range of assessment processes as part of your qualification. You'll need to be able to be assessed to achieve the skills and knowledge required by the course. This could be written, oral, or practical assessment methods, and you get what we call a satisfactory or not satisfactory result. And some of our assessments may cover more than one unit. There is a range of methods included on this slide. As part of your training, you also have to undertake what we call 120 hours of workplace placement. This is organised by us with agreed health and community facilities, and that's the minimum number of hours that you must undertake in the workplace. It's usually in a 3-week block, but other placement arrangements can be made available depending on our industry partners, for example, 2 days a week over several weeks. You could be starting work at 7 a.m. or in an afternoon shift, which may go up to 10 or to 11 o'clock at the latest in the evenings. Some Saturdays may also be included in your roster. Just please note that the time to complete your course may extend past the period of study, depending on the availability and timing of these placements. You may be able to organise your own placement if you know of a facility that's willing to work with us. We would have to put in a placement agreement with that facility and ensure they can provide supervision for you as a student. There are some workplace course requirements. You have to undertake what we call a satisfactory national police check. You have to have a valid working with children's check at that volunteer status. You also need to undertake mandatory health worker vaccinations and immunisations. This includes the flu vaccination. We also need to ensure that you, as a potential student, that you notify us of any pre-existing conditions. This is done as part of your pre-training review, which can include any physical or mental health conditions. Noting that a workplace facility may actually refuse to accept a student for workplace experience based on the information on their police check or lack of adequate immunisation. If you have any queries or concerns, please talk to us before you enrol. So what are the vocational outcomes for an allied health assistant? Well, just to let you know, it's a hands-on role. You assist allied health professionals, i.e. physiotherapists, occupational therapists, with the healthcare treatment plans of their clients. It's a collaborative role. You work to provide a high standard for client therapy and support in order to improve a client's recovery, their independence, their quality of life, and their well-being. Allied health assistants can also help reduce the risk of complications in chronic conditions or following illness or injury. You'll be providing therapeutic and program-related activities and support under the guidance of the allied health professional. This supervision may be direct, indirect, or remote, and would be occurring within an organisation's policies and procedures. Work settings may include hospitals, community health services, and residential care, just to name a few. Your classes. Your classes are timetabled 2 days a week, 2 sessions a day. There's a morning session, an afternoon session, but you may also be scheduled an evening session, anywhere between 5 and 9 p.m. on weekdays. There's some sessions that will be scheduled over several Saturdays just due because of the volume of assessment and work that's required in relation to the specialisations. The course was generally completed over a 12-month period, and you'll undertake induction and orientation at the start of your course. There's guided study, practical and assessment sessions, either in the classroom, online, or within our simulation health laboratories or our gymnasium. We get a new gymnasium in the middle of 2021 as part of the revitalisation project here at Bendigo TAFE. Classes are not timetabled during school term breaks or on public holidays, and you will get a timetable at the start of your training. Please note that we please ask you not to organise your holidays until you know when your practical placements are, and that you ensure that you have contingencies in place for your work and children so that you can attend all of your classes. Courses commence twice a year, once in February, and the second intake per year is generally in July, but it could be October. Courses operate 2 days a week, as I've said, with scheduled evening and or Saturday classes over that 12-month period. And next year's timetable will be available shortly. All these dates are subject to change, especially in regards to practical placement. I'm going to let Teresa talk a little bit now.
Thanks, Cheryl. So as you can see by this slide, we have quite a range of student supports that are available to you. I won't go through them, but please have a read, and if there is anything that you think you may require or be interested in, please make sure you contact me. As you're aware, this course is one of our free courses, so it's government listed as a free course. To be eligible for a free course, you need to meet the basic Australian requirements as listed there. For a free course, you have only one option of taking up a free course, so please choose wisely. Free course covers the cost of the tuition, but there will still be materials, consumables and student service fees, which please once again contact me and we can discuss these for you. During your study with us at Bendigo TAFE, you may be contacted by either a government or a non-government agency just to discuss your experience with your study with us. Fees and part payment plans. So once you've completed your application and you're ready to actually pay your fees, what you can do is take up the option of a part payment plan, which is through an external agency called Debit Success. There is a deposit of $250 required. You nominate your bank account and then the amount is debited out of that account. The application process, luckily we have a wonderfully straightforward application process. So please head to Bendigo TAFE website, look up the course, click the Apply Now button, fill in your details, which will then come to me, so I'll have your details as well. The prerequisites for the course include attending an information session, completing your literacy and numeracy test to the level required for the course, undertaking a pre-training review. Once all that is done, your eligibility requirements are met, you'll be able to finalise your enrolment and commence the course. If you have any questions on anything to do with your enrolment or the course, please do not hesitate to contact me. My email address is right there on the slide.
Thanks, Teresa. That was wonderful. We'd like to thank you for listening to us today. I will go back to the slide just before because it does have Teresa's details on it. And we look forward to seeing you in the future. Thanks very much, everybody.
Thank you. Bye-bye.